But ideally, in many ways, we never get to another pandemic. We get so good at responding rapidly to outbreaks that we can get on top of them and they never balloon out of control. Diagnostics have to be the first line of defense in any outbreak or any pandemic.
If we talk about universal health, if we talk about primary health care, this is about the people. So affordable, easy, feasible, and usable, user-friendly. But it can be done because we have seen a lot of progress in the last 20 years.
Without testing and without the ability to have a diagnosis, you cannot manage a problem.
As much as we go out to the villages, as much as we provide primary health care at health posts, as much as we provide it at clinics, we provide it in hospitals, regional and the tertiary. Our main experience, even from COVID, is that the testing, the diagnosis is still far from the other package.
Over the last few years, we have seen an explosion of technologies that are bringing molecular testing even closer to the community, even closer to the primary care. These are technologies like the ones I'm holding here.
Diagnostics that are available, but we need to see where the women are and how do we access them rather than how they access us in terms of healthcare.
This is another tool to advocate for decentralization of testing. And I think what's important is for those of us working in this space to really coordinate.
There are a lot of existing pool procurement mechanisms that could potentially be extended to include NTDs and other diseases. And I think what's missing there would just be the catalytic funding to ensure that that would happen.
This week is also FINE's 20th anniversary. We were founded at the World Health Assembly in 2003, so exactly 20 years ago. And we were founded because the recognition at the time of the need to address global health directly and the need to provide access to treatments and vaccines. There was also recognition that diagnostics are important. At the time, I think it wasn't clear just how important they are.
We have a resolution that is not bracketed. It is greened throughout. This was the initial draft. I hope the second one will have more input, your inputs as well, that will propel it to the next phase.
All anybody would talk about was vaccines, but we forgot the diagnostics are the very cornerstone of health, of universal health coverage, of primary health care, that we needed diagnostics.